Everybody. This is Dr. Doug Willen, and welcome to my first Exhale Method Live. And whether you're actually here with me live right now, or you're watching this recording tomorrow, next week, or I don't know, maybe even 6 months from now, welcome. I want to use these lives to do something a little different. I don't want this just to be me sitting here and talking about sleep apnea. Instead, I'd rather this to become a place where we could actually practice, where we could work on some technique, whether it's breathing or whether it's like the Buteyko breathing or myofunctional exercise of the tongue, the mouth, the lips, the throat, and the cheeks. But a little background, I've been a chiropractor for 28 years, and I practice in New York City, working with both human and animal patients. I'm also an animal chiropractor. I'm also the author of a newly released book this year in 2026 called Apnea Unmasked. This is what it looks like. Can you see that? Pretty cool. And over the last several years, I've become increasingly focused on breathing, airway function, tongue function, and sleep apnea rehabilitation. And that's really what led me to create something called the Exhale Method. That's the technique, and I call it the Exhale Method. I also run an online Exhale Method community, and it's on that platform called School. I don't know if you guys have ever seen School. One of the founders, or one of the owners, the founder is this guy named Sam Ovens, but one of their big investors and now co-owners is Alex Ramosi, who's a big influencer in the business world on YouTube. You've probably seen this guy before. He's a big muscular guy with long hair and usually wears a piece of tape across his nose, but he's one of the biggest guys in social media now, and he's also one of the co-owners. But in this Exhale Method community, that's where we work on improving and what I call apnea rehabilitation. Hold on one second. I didn't turn this off. So I call this online community the term for the space. Remember, it's an online space. We call it the breathing gym. And I wanted you to start thinking about breathing differently. You go to a gym because, hold on, here we are back again. You go to a gym because you want to improve something, right? You want to work on your strength, on your mobility, your endurance, your coordination. You don't go to the gym once and say, okay, I exercised, I'm done for the rest of my life. No, you train. And I think we need to start looking at breathing, the tongue, and the muscles surrounding the airway through a similar lens. And that's what we're going to be talking about today. And before we go any further, I want to make something very clear. If you have sleep apnea and you've been prescribed CPAP, like a CPAP machine, or an oral appliance, or another medical treatment, I am not telling you to stop using it. Never. You need to work with your doctor. I'm not your doctor. Sleep apnea can be a serious medical condition. What I'm interested in is a different question. What can we train? What can we improve? So you have this diagnosis called sleep apnea or obstructive sleep apnea or central sleep apnea, but you have a sleep apnea, or maybe you're severe snoring, because we work on that same continuum with severe snoring people. And within your diagnosis, within your mode of therapy, let's say you're on the CPAP machine, our philosophy is we train the human that wears the CPAP at night to move them on a continuum towards building health. And as you build health, you become less dependent on everything, usually medication, usually life supports that you need, like oral devices or CPAP. And over the last couple of years, I've helped by coaching, I've helped over 100 of my patients in my New York City office uh, get to a point where they're able to retest with their sleep doctor. And they, after 6 months, 8 months, 10 months, a year, they felt like they were strong enough now to have a serious retest of their sleep. And we've had some that had to remain on CPAP and a few that tested their way off. Now, probably about 100. So, what can we improve? And that's what we're always looking at. What happens if we start treating breathing and airway function as something that deserves rehabilitation? And that's what I mean when I say sleep apnea rehab. And I think that distinction is incredibly important because treatment and rehabilitation aren't necessarily the same thing, right? If somebody injures their knee, we might stabilize that knee, right? But then once the surgery's over or that initial acute phase, we usually have that patient with the knee injury go into rehabilitation. They do physical therapy. We teach them how to strengthen their knee. We restore movement. We improve coordination. We gradually increase capacity with strength, endurance, resiliency of that knee. So I started asking, why aren't we having more of that conversation around sleep apnea? Like, what about nasal breathing? What about dysfunctional mouth breathing? What about tongue strength, tongue position, the muscles of the mouth and throat, breathing mechanics, breathing chemistry? And what about the habits you repeat all day long? And that's the world I want to explore with you. And one of the measurements that I use in this work is something called the BOLT score, BOLT, BOLT. BOLT stands for Body Oxygen Level Test. Now, I want to be careful here because people sometimes misunderstand this. The BOLT score is not a contest to see how long you can hold your breath. It's not a maximum breath hold of any type. We're not trying to set a record here. We're not even trying to set your personal best here. That's not what's important. We're not even trying to prove how tough you are, like how much you could suffer and endure. That's not the BOLT. Rather, it's a controlled breath hold that gives us useful information about how comfortable your body is with the normal buildup of carbon dioxide. Think about that. We normally think of carbon dioxide as a waste product, right? We want to exhale it. And that's true. It is something we want to have exit our body. But while it's in our body, in our bloodstream, it has a lot of important physiological uses. So the carbon dioxide also needs to be at certain levels. And if it gets too high or too low, that knocks off the body's homeostasis. Now, that also happens when you fall asleep. When you sleep, your carbon dioxide naturally rises a little bit, and that's normal. But typically, people with dysfunctional breathing, snoring, sleep apnea, their brain and their central nervous system panics a little bit with any type of fluctuation in CO₂. And you might go into an apnea, you might go into a snore, you might go into an airway collapse. And that's something that we train by day to be more functionally able to handle CO₂ fluctuations, be more CO₂ tolerant, and handle that so that at night, when you're on autopilot, your body handles it without panic. So here's the basic idea. Let's do the BOLT. You breathe normally through your nose, no giant inhale beforehand. So you're like breathing in, breathing out. We're not going, we're not doing that. No dramatic exhale, just normal breathing. And after a normal inhale and a normal exhale, you're going to gently pinch your nose and then you wait. But you're not waiting until you're desperate for air. You're waiting until you feel the first clear desire to breathe. And then you will release your nose and resume normal breathing. Your breathing afterwards should still be controlled. That's important because if you release your nose and immediately go, you probably pushed it too far. And that's not what we're measuring. If you're watching this and you're brand new to breathing work, don't become obsessed with the number. Think of the Bolt score as information. It's one piece of the puzzle. Now, let's actually do some work, because that's what I want these lives to become. Let me turn on my timer on my phone and we'll do a Bolt right now. And if you have a phone, put the timer on for a second, or the stopwatch. So where's my stopwatch? Here's my stopwatch. And we're going to inhale through the nose. Do it with me. Exhale through the nose. Pinch your nose. I just breathe. I'm going to hit stop. It was probably 2 seconds back, so around 29, 30 seconds. Now, if your number when you needed to get that first trigger of breathing was under 15 seconds, it typically means, that you're being triggered by that lack of oxygen, a rise in CO₂, and that's something you'd want to work on. Over 20 seconds is good. Over 35 seconds is excellent. The more you do it, the better you get, or the more resilient you get, and the more you can train this. Think about it. People that do the free diving, where they hold their breath and go under, even if they were a champion, they weren't a champion the first day. So they might have had some natural ability and natural athletic skills that suited themselves to that sport. And that's where they just put the fins on and swim as deep as they can, holding their breath. But it's something they train constantly, and they're training CO₂ tolerance just like we do, except we're not world-class athletes. We're just doing it to have better nighttime breathing and control with sleep apnea and snoring. But it's a breathable skill. It's a trainable skill. If you're just tuning in, welcome to the Breathing Gym. So let's do what I call a micro practice. In my school community, SKOOL, we have, and this is what it looks like. So it's school.com. Let's see. Yeah, school.com/exhale method. And I would probably want you to come to the about page first. So it's school.com/exhale method/about. Anyway, when you get there, you'll see, or we have a free membership going on right now, so you could join for free. But we put up a micro practice of the day. It stays for 24 hours. Then a new one comes up the next day. I put up 6 new ones a week, 24 new ones a month. And if you join the $19 membership, you get the whole vault of it, which over, it's getting close to 200 micro practices in the vault. But if not, you can do it for free and just do one a day. So you check in and do your 3-minute one every day and start working on training this. So if you're driving, walking somewhere, or doing anything that requires your full attention, just watch this part and you can practice later. But otherwise, try it with me right now. You're going to sit upright, relax your shoulders. Here, let me put my screen back on. Okay. So you're going to sit up, relax your shoulders, close your mouth gently, lips together, teeth slightly apart. So your lips are together, but your teeth are a little apart, tongue resting up against the palate, the roof of the mouth. Now, sometimes we're going to do it powerfully, but right now it's just going to gently be up there. And for your information, something that we teach is that the tongue should be on the roof of the mouth all the time, except when you're eating or talking. So that's something we try to train, because if you can learn to do that and get a reset at night, And let's say your tongue is mostly, while you're sleeping, on the roof of your mouth because you trained it during the day over several months of doing that, you're less likely to have your tongue collapse backwards and create an obstruction. So we're working on that a lot. So back to lips together, nasal breathing, teeth slightly apart, tongue resting up against the palate. You're going to breathe quietly through your nose. Nothing heroic, nothing exaggerated, just quiet nasal breathing. Now make the breath a little smaller. I sometimes describe this as underbreathing. You're going to breathe less. I also like to call this invisible breathing, if you ever watch any of my videos on it. Invisible breathing doesn't really make sense, right? Because you're not seeing it. But it's so stealth, it's so quiet that if a friend of yours was this close to you, they would be like, "Are you even breathing?" So that's invisible breathing. Now, you're not starving yourself for air. You're simply turning down the volume on how much air is coming in and out. So you gently inhale through the nose, gently exhale through the nose, tiny pause, and repeat again. Small inhale, small, relaxed exhale, tiny pause. Keep the shoulders down and quiet. Keep the face relaxed. Try to create almost no sound. Be invisible, be stealth. Continue that for a few seconds and notice what happens. For some people, this feels incredibly easy. For other people, reducing the breath even slightly creates an immediate feeling of air hunger. So let's go back to it one more time. Inhale through the nose, exhale through the nose. And this time, consciously try to breathe 10% less, 10% less volume coming in and coming out. So inhale, a little less. Exhale, a little less. Pause. We're teaching the nervous system that breathing does not always need to be big, loud, fast, or through the mouth. And this is why I call these micro practices. You don't necessarily need 45 minutes every day. You need repetition, a minute here, a minute there. You can do this when you're driving, little 2-minute practices, practicing throughout the day, being aware of your breathing, being aware that your mouth is open, being aware that just getting in and out of your car, your mouth is open, your tongue is lazy, laying on the bottom of your mouth. And that's not supportive. So we're training away from that. Now let's move from breathing to another incredibly important structure, which is your tongue. A lot of people think of the tongue as something that helps you talk and taste food, and that is true. That's what it does. But your tongue is also a muscular structure that has a very important relationship with the airway. So let's do a simple tongue micro practice right now. You're going to put your tongue against the roof of your mouth and try to create a suction. So before we had the tongue up there, nice and relaxed, but now we're going to put a little more power into it. So, it's that suction that you could pop your tongue. So, but we're not going to do a popping exercise right now. I'm just showing you where my tongue is in my mouth. And almost like you're creating a vacuum, you're sealing the tongue against your palate. Hold it there. Now put your lips together. My teeth are apart. My tongue is up. But you need to keep breathing through your nose, inhaling and exhaling nasally only. You may notice this is harder than it sounds, right? You're keeping the tongue suctioned upward, and I don't want you to clamp your teeth. Don't tense your jaw. Keep breathing quietly through your nose and relax. Now let's do it again. And this time, do it with the least amount of effort where you could still create a suction. So instead of going for it, like, you're going to do a gentle suction, just enough to hold it up there, but try to let everything else go relax. So it's not just touching, it's up there, vacuumed for sure, it's suctioned up there, but instead of suctioning like with all my strength and all my power, I'm just enough that it doesn't fall. My teeth are apart, my lips are together, I'm inhaling gently, exhaling gently, and my tongue is living up there with a little bit of suction, but nothing more. So I usually find it with my mouth open. And then I do less, not more. I now let my jaw close, my lips close. My teeth aren't touching, they're still spaced. Now I'm going to focus on my inhale. Focus on my exhale. Pause. Continue. Create that suction and hold. Nasal breathing, stay relaxed. And that's training. It looks simple, but if your tongue fatigues quickly, if you can't create the suction, or if it immediately falls away from your palate, that's something we can work on. That's trainable, and that's the whole philosophy behind the breathing gym. We assess it or find it, we train it, we repeat it. Now, let me give you two of the biggest myths that I hear around sleep apnea. The first myth is if I use CPAP, there's nothing else for me to work on. I disagree with that. CPAP can be incredibly important. For many people, it is an essential treatment, of course, but using CPAP doesn't mean you suddenly stop having a tongue. It doesn't mean nasal breathing no longer matters. It doesn't mean the muscles surrounding your airway no longer matter. It doesn't mean your daytime breathing habits no longer matter. To me, you can respect the medical treatment and still ask questions like, what can I improve, right? Those two ideas can coexist. My own father is 88 years old. He's been on a CPAP for 15 years. He does very well with it. I would never take him off of it. I want him, he's comfortable with it though. He sleeps well with it. He sleeps a long night. He doesn't move too much. He does well. So that's great. Stick with what's working. Most of what I do, most of the people I coach, the people that join my community are people that are looking to change everything. They either had a CPAP diagnosis, a sleep apnea diagnosis, and were recommended or prescribed a CPAP machine or other oral device, or maybe even surgery or laser or a medical implant that stimulates the hypoglossal nerve in the tongue that keeps your tongue excited during the night so it doesn't get lazy and collapse and go flaccid. And those are all well and good, but within your diagnosis, within your device, you could still train. Think about someone that destroyed their knee playing pro football or pro soccer or whatever sport, and they had to have total ACL surgery. And right after the surgery, they're on crutches or in a wheelchair. They wouldn't necessarily not do rehab, right? They would go right into rehab after the surgery as soon as possible, and they would begin to train. So even if they were in a wheelchair, they would be doing as much as they can training, right? And most every disease and condition has a rehab component, except we really don't see that with sleep apnea, and that's what I get excited about. So I teach apnea rehab. So the second myth that I like to bring up today is the idea that there is one magical exercise that's going to cure everybody's sleep apnea. Someone might teach, well, the only thing you need to do is this one exercise, or tape your mouth and that'll handle it, or learn this breathing technique, or do this for 7 days and your apnea disappears, or lose 30 pounds. That's all you need to do. But that's not how I look at this. Sleep apnea is complicated. There can be anatomical factors. Weight can matter. Yes, but not always, because I have skinny patients that have horrible sleep apnea. I have marathon runners and triathletes that have had their huge obstacle of sleep apnea. Sleep position can matter, how your body is when you're sleeping, back sleeper, side sleeper, stomach sleeper. Overconsumption of alcohol can matter. Nasal obstruction can matter. The jaw can matter. The tongue can be a factor. Breathing patterns can be a part of this. Neuromuscular function can be a component, and different people have different combinations of those factors. And that's why I don't believe in one magic exercise. I just haven't seen it clinically. You know, I've worked with so many people over a 28-year career, and not everybody shows up the same way. And that's what this Excel method is really starting to become. It's a systematic way to look at the pieces we actually have and how they influence us. And it gives us an opportunity to begin training them. We train breathing, we train nasal function, we train tongue function, oral posture, breathing tolerance, CO₂ tolerance, daily habits, recovery. And then we repeat. It's boring. We do it again and again. And that's why I want to start doing these lives regularly. Sometimes we're going to talk. Sometimes I'm going to teach. Sometimes we'll do a breathing workout together. Sometimes we'll work on the tongue and airway muscles. And sometimes I'll answer, questions. And sometimes I may spend an entire live stream breaking down one tiny little concept. Hold on one second. But every time you come here, I want you to leave knowing something or having actually done something. So if you're watching this recording and you're thinking, okay, Dr. Dog, I understand the concept, but how do we get started? How do we actually start? One thing I can say is you could join me inside my online community called the Excel Method community, and you can start for free. We have a free community. We also have a higher tier at $19 a month if you want to be part of live Q&As and Zoom calls and other training. For example, tomorrow night, we're doing a 90-minute training. And that's where I built what I call the breathing gym, and where we're putting this work into practice. So if you're dealing with sleep apnea, you're on a CPAP machine, or you're dealing with snoring, mouth breathing, or you're just simply trying to understand what your body may be capable of improving, well, that's exactly why and who I created this community for. And if you're looking for more individualized help, I also work privately with a small number of people through my elite coaching program. That's a whole year program. And that's really for people that are extremely determined to maybe retest their way off of a CPAP machine. And they're like at their wits' ends. They just can't sleep with the CPAP. They're miserable. They're having, they're now living in a different bedroom than their partner. It's just, they're at a point that they want to put their heads down and see what their body is capable of changing and doing. You can learn about that inside the community as well. But, the best place is just to start for free. So, but wherever you are, starting from, don't feel like you need to change everything today. You start small. Your first assignment could be incredibly simple. For example, pay attention to your breathing today. Is your mouth open or closed? Are you a mouth breather more than you think? And it's not just sitting in front of your computer, like I'm sitting in front of my computer now. Watch, my mouth is closed. But that's not hard to do. I'm sitting. But what if I start walking around or doing the dishes or taking my daughter's dog out for a walk? Then what happens? Now you're adding a tiny bit of stress, right? You're doing exercise. And what happens to your tongue then? Where's your tongue? Are you breathing quietly through your nose, or did you go into some overbreathing? So awareness is one of the first things you could do. And you can spend just a few minutes in the breathing gym for free. That's where we start. So it's at school, SKOOL, school.com / exhale method / about. It's also going to be in the description, and it's on this YouTube channel. It's easy to find. So welcome to the exhale method. Welcome to the breathing gym, and I'll see you on the next live.